Hello and welcome back to my channel. My name is Dr. Caroline Levy, an internal medicine physician. It is good to have you back. Today we discuss an interesting topic on diabetes called diabetes neuropathy. Diabetes is defined as a chronic state of hyperglycemia or high blood sugar in the body that results in several complications. And one of the complications that we're going to talk about is neuropathy, meaning nerve damage. Diabetes has two forms, type 1 diabetes, which is mainly found in children, and type 2 diabetes, mainly in the older adults. Both these forms of diabetes can result in a complication called neuropathy, which is nerve damage. The commonest complication, apparently more than 50% of patients actually complain of this neuropathy, and if left untreated, can lead to several complications, even up to the point of amputation of your feet or toes. And so that is the need to address this topic. How will these patients present? So patients will present with a tingling sensation on the hands and on the feet. They'll have burning pain in their feet, which is worse at night. When they're sleeping, the pain comes on, but when they're active and walking, the pain is less. And that will be a diagnostic way to know that this is likely neuropathy or nerve damage that we're dealing with. The other presentation is that these patients will have numbness, they'll have a difference in temperature, maybe feeling very cold when it's supposedly warm. And all of these can be signs and symptoms of diabetes, but that is only in the sensation part, meaning what you feel. There are other hidden symptoms, what we call autonomic symptoms, what affects the inner parts of the body. The patient will complain of dizziness when they're rising from a sleeping position, or they're feeling always bloated and full, meaning they have what we call gastroparesis. Their food is not moving well in the stomach or in the abdomen. Like you have a hyperactive bladder where you're either going to the loo very often to pee or retaining urine. And these are some forms of those autonomic symptoms that we look out for and that you need to mention to your doctor if you have any of the above, especially if you have diabetes. Apart from diabetes in itself, if you are at risk or if you have several conditions like high blood pressure, high cholesterol, heart disease, obesity, if you're a smoker, all this can predispose you to getting diabetic neuropathy, and you have to watch out for that also. Diabetic neuropathy, as we mentioned while we were starting, the reason we are very keen to identify it early and to treat it is because of the complications that it causes. The fact that you lose sensation, the nerves are damaged, you lose sensation to your legs, that puts you at a risk. Say if you step on a sharp object, a nail or a splinter, and that will cause a wound or an ulcer that actually takes so long to heal, what we call chronic wounds or diabetic feet. These wounds or ulcers, if they affect the muscles and then progress onto the bone, they can actually result to amputation, which is the most common feared complication of diabetic neuropathy. You can lose your toe, you can lose your feet or your leg, depending on the area where the wound is. So we really have to protect our feet, more so if you have diabetes. How will the doctor or clinician know that you actually have diabetic neuropathy? Medical history is the most important thing. One needs to mention that when you go to see the doctor, if you're having any of the above symptoms that I mentioned earlier. But also, a proper foot exam will be conducted and should be conducted. And this has several ways. So we look at features of diabetic feet. And these features are, do you have any callus formation? Is your skin on your sole very dry? Do you have clawed feet? Do you have ingrown toenails? And do you have shackles foot, just very clawed nails that are deformed? Other things that we look for, we look at signs of nerve damage. And one of the things that we'll do is to use what we call a monofilament, which is attached up here. And what we check for is we check, do you have sensation in different parts of your feet? And the different places that you check for. And if you actually have any impaired sensation in these places, then we know that you have diabetic neuropathy. Prevention is key. So how do we prevent diabetes neuropathy from happening? And how do we prevent progression in case you actually have it? You have to do daily foot exams, wash your feet daily, check in between your toes, make sure you don't have any fungal infection, dry in between your toes very well, and check for any calluses, check for any wounds. Wear very comfortable shoes, especially if you have diabetic neuropathy. Cushioned shoes, do not wear open shoes, especially when going out to the farm, because then you can be pricked and you may not feel, and that will develop into a wound. So daily foot care is the first form of prevention. Once we diagnose you with a diabetic foot or diabetic neuropathy, there are several forms of treatment. The first thing is control of your blood glucose level. You need to see a specialist or a physician for this and make sure that your sugars are under control for two reasons. One, to prevent the neuropathy, but also to help any wound healing to occur. The second thing is we need to treat or correct your blood pressure, we need to correct your cholesterol levels, we need to correct your heart or treat your heart in case you have any of these risk factors that will predispose you to getting the neuropathy. In case you develop a wound, then we need daily wound care, and for this you are referred to see a wound doctor or a wound nurse or even a plastic surgeon, depending on the extent of your wound, and they will decide if they're going to clean the wound or the ulcer and what other management. If the wound is infected, then there is a role of antibiotics and will be administered for the duration of time that you need. Like I mentioned, if the foot or the toe is not salvageable, then there is a role of amputation, and this will protect the rest of your body and the rest of your foot from getting infected. In summary, that's basically diabetic neuropathy. And remember, prevention is key. The first form of prevention, check your sugars daily. If you have diabetes, do daily foot care exams. Protect yourself from getting any injuries as much as you can. And even when a wound develops, then present yourself to the nearest facility and they'll be able to do a foot exam. Thank you very much. In case of any other questions, feel free to reach out. God bless.